evening from Washington. I'm Larry O'Connor, and we begin tonight with new concerns over the COVID-19 mRNA vaccine and new revelations about the importance of natural immunity. Joining us is the innovator and inventor of the mRNA technology used for the vaccines, Dr. Robert Malone. His new book, Lies My Government Told Me. Dr. Malone, thanks for joining us.
Thanks so much for having me here, Larry.
Now, I just want to be accurate here. You discovered and invented and developed the technology used for the COVID-19 shot, not specifically for COVID-19, though. You just developed the technology for various other therapeutic purposes, right?
Way back in 1989 and 1990 and 1991. So I had nothing to do with these vaccines, never claimed otherwise. And there have been improvements in the technology since my original patents, many of which are here behind me.
Yeah.
This isn't exactly what I had planned or had disclosed or invented. There's been modifications and many years since, and unfortunately, the FDA allowed the developers to circumvent normal processes to ensure safety and effectiveness, and that's what got us here.
So, and of course, your concerns that you've been very vocal about with regard to the COVID-19 use for the mRNA vaccine technology, it has nothing to do with the actual technology itself. It has to do with what, the lack of testing or the application specific in this case?
Actually, what has been revealed over the last 3 years is that there are fundamental problems with the actual formulations. We could call that the technology that are independent of the issues of the toxicity associated with the spike protein.
I
So
see.
we now have multiple vaccine candidates that have been tested. Most recently, the Moderna influenza phase 3 trials have failed due to adverse events, in other words, toxicity. So that tells us that the formulation technology itself, as being deployed, has problems. And then we have the multiple examples of a variety of vaccine-like products that have been advanced that involve either purified spike proteins, such as Novavax, or, for instance, adenovirus-expressed spike protein, and they share many common side effects or adverse events with the mRNA jabs. So we have a situation here where virtually all the components seem to have significant toxicities that were not previously characterized.
Let me ask you just point blank then, with regard to the most commonly utilized and for that matter mandated COVID-19 shots, the Pfizer, the Moderna, and the Johnson and Johnson. Of those three that we've been living with for the last year and a half, 2 years, are they, just to put it blankly, are they safe?
In my opinion, and that of the 17,000 physicians and medical scientists that I work with the Global COVID Summit Group, otherwise known as the International Alliance of Physicians and Medical Scientists, we've called for the withdrawal of these last year. I think it was April 11th. Our opinion is that these products are not safe, nor are they effective in preventing infection, replication, or spread, and increasing of the virus. Increasingly, the data demonstrate that multiple inoculations with these are actually creating greater risk of patients developing COVID or of dying. Unfortunately, that data is not yet crystal clear in the United States, but the data from the Cleveland Clinic demonstrating that the more jabs you take, the more likely you are to develop clinical COVID is pretty bomb-proof.
So now let's just flesh this out a little bit because there are people who are past the age of 70, let's say, maybe who have lung disease or other comorbidities. Their doctors are suggesting that they have a regular routine of boosters so that they have the antibodies in their system should they get COVID. These are the people who are in the highest mortality group, right? Older Americans with comorbidities. Are you saying that even for that group, it's probably not a good idea to get this shot?
Unfortunately, what the data show is if you stratify by age, the risk of the vaccine also increases when you get older. And so you end up, again, making a ratio of what is the risk of the virus and the risk of the vaccine
Mhm.
by age cohort or other risk factors. And the unfortunate truth is the data demonstrate that the product is not safe or sufficiently safe or effective to justify the vaccination for the low risks associated with the currently circulating variants. It may have been different with the original Wuhan strain or with Delta. Those were different viruses with different pathology profiles or pathophysiology. But with the currently circulating strains, which seem to be much less pathogenic currently, you really can't justify by the numbers using these products in the elderly, particularly if you provide to those same elderly access to early care. The data are quite clear that you can get 98 to 99% protection against death and significant disease if you provide early onset treatment with a wide variety of treatment protocols. You can have ivermectin, I believe, and many others do, is helpful, but it's not the only agent. There are many agents. If you get on this early, you can stop disease and death. You don't have to wait until your lips are blue, which is unfortunately the protocol that the federal government has advanced. So that's the way to handle the elderly, is to make sure that they have access to early treatment, good physicians that will treat the disease, and testing to ensure that they're detected early in their clinical course, and that keeps them out of the hospital. The jabs, the data are not supporting the risk benefit even for the elderly. It's very
Mhm.
unfortunate. I wish that wasn't the case, but the data are the data.
And meanwhile, doctor, on the other end of the spectrum, for younger Americans, we've just seen the government, the CDC, change their immunization protocol recommendations for school age children, and they've added this CDC, COVID, or excuse me, the COVID-19 mRNA shot to children's protocols. And my
In in
understanding of
stark
children who have
in
actually,
stark contrast to the United Kingdom or Great Britain, in
right.
which they have withdrawn this, they had been moving in the same direction, and then Asim Malhotra and many others brought to the government and the National Health Service the actual data. And based on that, the UK government made a unequivocal decision to stop this. What has happened at the CDC is bizarre, unfathomable. It's difficult to interpret that without resorting to comments about conflict of interest and other
Well,
related issues.
maybe we could go there in a tangential way in a moment. Dr. Malone, there's so much to get to on this very important topic, and we're lucky to have you. So, if you could hold your thought there, I want to do one more segment on this because, listen, the one thing that we've heard from the government over and over and over again, from Anthony Fauci to then President Trump to now President Biden, all the way up and down the spectrum, is that these shots are safe and they're effective. And in our opening segment here, you pretty much laid out how maybe that safe part isn't necessarily accurate. What about effective? We'll get to that in just a moment with Dr. Robert Malone. His book, again, Lies My Government Told Me. And we'll find out, are these shots effective in any way whatsoever, or are they not only unsafe, are they actually not even doing the job they were designed to do? That's coming up next. Keep it here. It's O'Connor Tonight.